On September 27th, the New Brunswick government announced that the province is extending so-called navigation services for workers with international credentials, including health professionals. The province believes that internationally trained nurses and other health professionals will help tackle the country's healthcare crisis. Post-secondary Education, Training and Labour Minister Trevor Holder affirmed that the new services would help internationally trained health professionals integrate into the province health institutions. Here is his announcement.
We've heard enough of it to know that it has been a significant roadblock and a roadblock that we need to tear down. In a province that's facing significant labor force challenges, particularly in healthcare, we cannot sit idly by while skilled workers are sidelined because they cannot get certified to work here. Newcomers are key to helping us build this province and meeting our workforce demands as well. Our government understands just how important it is that we provide clear and quick pathways that will allow them to use the skills that they have as soon as possible. Back in the spring, I was proud to introduce new legislation that was aimed at helping internationally educated people become certified in their professions more quickly. The Fair Registration Practices and Regulated Professions Act is all about supporting new pathways to employment for newcomers here in New Brunswick. If we want to continue growing this province, we must make New Brunswick as welcoming as possible and to tear those barriers down that cause people to look for employment elsewhere. If we want those who have the skills to come here and join our workforce, we need to have the right supports to help them join the workforce in a timely and efficient manner. For some time now, we have been providing a navigator service to increase the number of internationally educated nurses that we are attracting, and we've had great success in that regard. And today, we're building on the success of that program. I'm excited to announce that this navigation service will now be extended to other health professionals and to all workers from regulated professions who earn their credentials in another country. That means whether you're a physician, a nurse, a veterinarian, a social worker, a licensed practical nurse, or other professional in any other certified occupation, we're here to provide the help that you need. We invite anyone who has earned their credentials in another country and does not know how to have their credentials recognized to visit or contact one of our 19 working New Brunswick offices across this province. And I want to say something that I've said consistently. Working New Brunswick is not just employment offices. It's a mission. It's a mission to get our people working, to get our communities working, and to get our provinces working. And it's designed to have the flexibility to meet the challenges that come before us. And today is another step in the evolution of that mission. Our employment counselors will work with clients to conduct a needs assessment, which will now specifically include international credential recognition as a possible intervention. As part of that service, they will incorporate steps into an employment action plan for the client and monitor the support of their progress. The counselors will also work directly with 3 navigators, 2 new ones, who are helping to develop materials and resources to assist newcomers to be able to work in their profession. These new navigators serve as subject matter experts and will work directly with stakeholders such as post-secondary institutions and professional associations. 2 of the navigators are already assisting those with credentials related to healthcare, and now the 3rd will be dedicated to regulated, non-health professions and will be ramped up over the coming weeks. While this initiative is all about regulated professions in New Brunswick, the challenge in the health sector are at the forefront of everything we do. We know that we are up against it in terms of providing quality, sustainable health care, and the Minister of Health and myself and our government are committed to looking at anything that we can do to find the resources that we need to make sure that New Brunswickers get the care they need and when they need it. And more importantly, the message that we have today is that we want to have a welcoming and inclusive province that makes it easier for people all over the world to help us build this great province to be even better than it already is. Thanks, everyone.
Thank glad that I'm able to express my experience, because I guess it will be very important, and also, give other international educated nurses the opportunity to enjoy and to go through the same experience. So for 12 years, I studied and I worked in parts of the United States as a registered nurse before returning home to Brazil, where also I work as a registered nurse. In 2020, I started looking at new opportunity to practice nurses in other countries. So France suggested Canada. Even though I lived in the States, I never really thought about Canada, making Canada my home. I searched the internet and I found New Brunswick. It was really a quick search, and the words that I put was, which province is nursing friendly that I could come and be easy to immigrate. So New Brunswick came first and Ontario came second. So that was the way I found New Brunswick. In 2021, I contacted the Nursing Association of New Brunswick for details. They told me about the Nurse Navigator for international educated nurses, and they gave me his email. I'm glad they did. They gave me the email of Mr. Rob Parker. Mr. Parker emailed me back very soon after. He was very helpful, and I knew I reached the right place. He was pleased to see my level of training and experience. He helped me for everything, including offering me the opportunity to be part of a specialized program for international educated nurse. I believe it's the cohort pilot program, which entails the recruitment, employment, and integration of international educated nurse, which also include assistance with immigration, which I needed. I needed the assistance with immigration and also the assistance with registration. And sometimes it can be confusing because we as educated nurses or immigrants that want to come, we need to look at both ends. I did a job offer, to qualify for the New Brunswick Skilled Work Exchange program with employer support. So Rob asked me for my resume when we were emailing each other back and forth, and I remember sending it on a Friday afternoon, and by the next Monday, I was already having an interview with Horizon. So it was very fast. And I was very surprised when that happened. So I received a job offer as a personal care attendant while I continue my effort to get my registration recognized. I'm working hard at this process, which is not easy, and I hope to be recognized as an RN soon, because this is what I am. Though I have emailed Rob back and forth, today was the first time that I had the opportunity to actually meet him. So I just wanted to extend my gratitude and my thank you to him and to this program, which has and is still making the difference. And I'm glad that you guys are expanding to other healthcare professions. Thank you so much.
I'll let you know. I know they don't.
So I could give you the list of all the things that we've done in the last 3 or 4 years, and we're starting to see some traction, significant traction in terms of the amount of international nurses that we've been able to recruit, in terms of the RNs that we've pulled out of the pool of LPNs through that bridging program. So there's been significant work done. The bottom line here was 4 years ago when we took office, everybody was going in different directions. And that's what's significant now, based on where we were 4 years ago. The first navigator was for nursing. Mm-hmm. We've got a second one in place to deal with all of the health practitioners, and then the third one will be all the other professions, especially, and we're going to focus on areas where we have labor market challenges.
Which are?
Oh, look, where do we start? I mean, whether it's in the trucking industry, whether it's in there's that IT sector. We've got some significant challenges in the IT sector. I mean, and those have all been identified. We will focus on those areas as we move forward. And we're not just focusing on the regulated ones either. We're also identifying those sectors as I've said many times, over the next 10 years. There are going to be 120,000 plus New Brunswickers leaving the workforce, and we need to be able to meet those demands.
So will the province accept nurses just from France or United States or from other countries like Bangladesh, India?
Actually, there was just an announcement yesterday about this mediated process for nurses from France. So yes, to your question, and actually there's going to be an announcement in the not too distant future about a number of different countries there that the recruitment team is going to go out to in order to recruit various healthcare professions. Look, I think Minister Holder did a great job in articulating some of the things that have been done over the last couple of years in moving that recruitment forward. We're going to have some more announcements in the not too distant future that I'm sure everyone will be interested in working with the RHAs. And again, having some HR resources in place to help with that recruitment, whether it's a physician, an RN, NP, LPN, the whole segment. It's pretty exciting because this is where one of the demands are in the healthcare, and that's the solution to some of the issues that we've looked at to make sure that again people can get primary care at a timely basis in order to address their issues. So an announcement coming up.
Correct, because in the process we have to take a test that's called NCLEX, which is for every RN in the States and also here. So already took that. So that's the reason why it's going to be a little easier. I started a year ago, in April last year. We also we need to get our credentials verified. So after we get our credentials, then we have to get a report, and from that report goes to the Nursing Association, and then from there the Nursing Association will tell us what we need to do. In my case, they told me they have a gap in my studies, so I have, they asked me to do an assessment. So after the assessment, they will tell me what it is that I need. They will give me my license, what I need to do more bridging studies. Well, until I found the navigator, it was difficult because I really did not know what to do, where I was going. So after I found Rob and the navigator, it was easier, to navigate and to know what to do. So I believe because of my position, because I was trained in the U.S. and, the U.S. and Canada, they have similar scope of practices for nurses. I believe that's the reason why it's just a little bit easier for me. But I believe, for other nurses, for other countries, I think the process will be a little longer because they still need to take the NCLEX, which could take them a year, to prepare for. It all depends. Each nurse, each country is different, so how they see it. So it's difficult to say. We got the Horizon or Dr. Thomas, and I work as a patient care attendant. So they gave me this opportunity to come and to understand the system and to work until I get my license.
For the NB Media Co-op, this is Arun Budathoki.